either in real time or at the end of the call, or if we didn't get to all the questions, then certainly we'll do the best we can to answer those offline. So the other thing I want to say is certainly we are not virologists. We're not experts in the viruses. We are not infectious disease specialists. We're not public health experts. We are your internal medicine doctors, nurse practitioners, and practice manager, and we are, you know, experts in what we do, and that's in doing our best to care for you.
No picture.
So we're going to do our best to answer the.
No, for us.
And be your guides.
Right there.
So on that note, what I'm going to do is share my screen and have,
A lot of people have pictures, right?
Meg answer the first question. Oh, the other thing I want to say is that I'm certainly not a Zoom expert, so let me can you all see the slides? Meg, can you see the slides?
Yeah, I can see your slides, but I also have them saved anyway. But
I don't want us autosave.
So the other thing I'll say is that all the emails that we've sent to you are saved on the blog and on our website. So if you go to the blog, if you had an email, you can't get it, there's some information about the
What's Rex's Wi-Fi password?
Yep.
So if you have any questions, and if you're not muted and got some background noise, just please mute your phone. Mute your call.
We can't get rid of the autosave.
Yeah.
We can't get rid of the autosave on your.
Hold on. Damn it.
if you mute yourself, if everybody mutes themselves, then it will be easier.
Okay.
You should be able to hover over your
111.
That's all right. Just
Yeah.
So Meg, why don't you take the first question?
Yeah.
I
um
want to stand. Just sit.
Sarah Sharp says the host can mute everyone.
Yes, I am working on that. Thank you.
Thanks, Sarah. We're working on this. All right, so I'm going to take the first question, and some of these questions I just want to say, a lot of people sent in questions that were similar.
Why can't I fucking hear this?
I muted you, sorry. I muted you, Meg.
Okay, so a lot of people sent in questions that were similar, so we've tried to consolidate the questions and make sure that we cover all the major points for everybody that had questions. But if there's something specific that you were hoping to hear that we didn't go over, please let us know. Okay, so the first question is basically, I read it is a dead virus, so how does it get activated in a human body? By one molecule or cluster? People were asking kind of about the basics of the virus. And so I just wanted to say a virus is something that invades our cells. So it's not dead necessarily, but without a host, it can't live. So it requires a body to invade, go inside our cells, use our cells' ability to replicate and divide, and kind of takes over our own cellular machinery for its own use. So that's how a virus infects humans, as it goes inside our cells. That's also what makes it kind of tricky to treat, because it's not like a bacteria that is separate and can, kind of divide on its own in culture and, it's its own entity. The viruses actually go inside our cells, and so it makes it very challenging to find because it's inside of our own cells, and then also difficult to target with treatments, again, because it's hiding within our own cells. And so what the body does when the virus invades our cells is it starts to get angry, so inflamed, and it starts to produce hormones and cytokines in response to trying to create an unfavorable environment for the virus. And with this virus in particular, it's actually that process of inflammation that has been leading to some of the complications that people are having, specifically what's called ARDS, or acute respiratory distress syndrome, which is actually an inflammatory response in the lungs that makes it challenging to breathe and oxygenate.
Great. I think that kind of dovetails into sort of the next question, which is really about, if I can go to the next question. How serious is it? And, if you do get it, what does that look like for folks? And certainly there are people on the call that are in this age group. So Dan, you want to talk a little bit about this?
Dan, you're gonna have to unmute yourself if you.
Okay, that should work now.
Yeah.
So the second question is, some reports say that for people over 75 or 80 years old, catching the coronavirus is a death sentence. You know the percentage of people that age who are admitted to hospitals that live and come out just fine. So who is at risk? So to take the risk part first, to speak about risk, there are some general trends to consider. Will, if you could bring up the table in slide 4. Those general trends, so younger people usually have less complications and lower mortality compared to older individuals. And patients with less comorbid conditions like cardiovascular disease, diabetes, renal insufficiency do better than those with concurrent health issues. Women also do better than men. Those that are fit do better than those that are not. And there are also modifiable risk factors. So living alone is better than being exposed to groups. Hygiene is important, as are precautions like masks and keeping distance from others. And I think it really, when it comes to older individuals, prevention is the key when we're talking about risk. So to answer the first part of the question, and actually if you could advance to slide 5, that just shows with more comorbidities that there's a increased risk. So it's not a death sentence to get COVID-19 in your 70s. Over 80% of people over 70 that get it survive. You can see there that for the rate of confirmed cases, it's about 22% for those over 80 years old. The chances of surviving go down if you're admitted, and go down even more if you're admitted to the ICU, and are even worse if you're actually on a ventilator. But it's important to remember that the statistics that are reported are likely, they likely appear worse than they are, because we have patients out there that are not being tested, and probably patients that are asymptomatic. So the rates of death overall in some of these percentages are probably look worse than they actually are.
There was a gentleman out in California that got COVID-19 at 103 years old, and then he ended up surviving. So even if you're 100 years old, you can survive COVID-19. So no, it's definitely not a death sentence. But if you are in a higher risk group, then you need to be taking particularly more precautions and trying to prevent yourself from getting COVID-19 until we've got treatments and vaccine. So that's not in the near term. Prior to the vaccine, we'll talk more about that. But so if you identify yourself as being at higher risk, then definitely we need to be taking extra precautions as we go forward. So Dan, what about this?
So when we bring home groceries or take out, what should we do to decontaminate them, if anything? Will kind of already addressed this in one of his blogs, if you've been keeping up with the mailers that we've been sending out. And it's a good reference to revisit, I think, with regard to the recommendations on decontamination and food safety. So it's really the packaging that you have to be concerned about. The National Institute of Health did a study that showed that the virus can be viable on plastic or metal for up to 3 days and about 24 hours for cardboard. So COVID-19 is not a foodborne illness. So the food, as I said, is not the issue. It's the packaging that creates the problem. Once you get home from the grocery store, you should wash your hands. And then probably the best strategy is if you can take non-perishable items and leave them alone for 72 hours, you're pretty much assured there won't be viable virus still attached to the containers. Produce should be washed with soap and water. Plastics, cardboard, and metal containers like cans can be wiped down with disinfecting wipes. And if you don't have disinfecting wipes, you can saturate a paper towel with a cleaning solution. I think one of the more important things to remember is you want to have an area of in my house, it would be the kitchen. You want to have an area that is decontaminated and an area that is contaminated. Contaminating mean that it's not sterile is the wrong word, but it's not clean. So the bags that you bring in the groceries with and the containers, you want to keep that in one area and then kind of systematically either wipe them down or discard the outer container and put them in the kind of clean area. And then once you're done, you should get rid of the bags, get rid of the containers, and then wipe down the area that you're using as kind of the dirty soiled area, and then remember to wash your hands after the fact. I think that's, you have to remember that even when you get home, I mean, you can take it to the nth degree, but I usually wipe down the steering wheel in the car and the outside of the door, just to try and make sure that you're not bringing anything from the grocery store back into the home. But when you're in your home and everything is clean, there's no need to continue to wash your hands because your home is in theory not contaminated.
Yeah, there was one question that someone asked, like, if you walk outside, does it get on your hair and on your clothes, and do you have to, wash yourself? Well, we've heard stories like that, but they're primarily around doctors who are practicing in highly intense and highly virus-laden environments. So if you're in a patient's hospital room where they're suffering with COVID-19, then it's possible that the virus is on your body or on your clothing. But if you're walking around your neighborhood or even walking into the grocery store, which are generally low, even if someone has COVID-19 in the grocery store, it's not going to be this mist of virus that you're walking through. It doesn't really work that way. So you don't need to worry about that level of decontamination of yourself and your body as you come home. The biggest concern and the way this virus gets transmitted, the primary way, and as Dan was talking about, food safety and washing your hands and all of that is so important, but the primary way that people get COVID-19 is by getting it from somebody else. A person, not a tiger, a person. And that person has to be somebody who has the virus in their respiratory system and they give it to you. Now, if that person is really sick and has a lot of virus, it won't take long for you likely to receive the amount of virus to make you sick. Okay? Now, if someone is less sick and maybe one of those asymptomatic carriers and they don't have a lot of virus, but they have enough, you have to be likely have to be within their orbit, within that 6 foot zone of safety for a long period of time in order to get that virus from them. So it's really, if you think of sort of the person having, what's the density of the virus? How much virus do they have around them? Like Pigpen, from Peanuts, So if you have that amount of virus, then do I want to be close to that person? So that 6 foot zone of safety that we talk about is so important. But you've got those few people that you love that are close to you in your house, your family. Those people are welcome to come inside that unless they're sick, and then you want them outside of that orbit. So all of this that we're talking about is about risk. It's about trying to reduce the chances of you getting the virus. And there's some things that we've heard or read. Somebody sent a question today about the virus being in water and then going out to sea and then get recirculating in the environment. The virus really is not, it's not safe outside the body for very long. As Meg said, it needs a host. It needs somebody to have it grow and survive. So it does not survive very long outside the human body. So keep in mind, it's not like a mist that you walk through that you need to clean yourself off. You have to be within somebody's 6 foot radius, and the more sick they are, the more likely you are to get the virus. So that gets to this question of asymptomatic spreading. We've heard about this, and it's kind of a little worrisome. It's like when this all started, everybody was getting scanned with the temperature thermometers, and if you didn't have a fever, you were safe. Well, that's not true, and it's likely that up to 25% of people who have infection with SARS-CoV-2 are actually asymptomatic, 1 out of 4 people. Now, as a public health issue, that is a concern because we don't really know who those folks are, which is why, I'm going to emphasize it again, the social distance, right? So if you're encountering people that you don't know, that aren't invited into your 6 foot zone of safety, if you're encountering them, if they're 6 feet away from you, then the chances of you getting infected from them is extremely low. And as Steph will talk about in a minute, and if you're wearing a mask, like a likely and hopefully a fabric mask, that reduces the chance as well. So that asymptomatic spreading is less likely if you're practicing proper social distancing. Now, how long are they likely infectious for? So let's say somebody gets infected and they have, COVID-19, but not a lot of symptoms. How long could they potentially spread the virus? We don't really know. I think that's a key theme to all this, is that we don't really know a lot of the answers to this, and hopefully we learn more and more, and we'll continue to update you as we do learn more and more. But my thought on this, to be honest with you, is imagine if someone had a real COVID-19 illness. There's some on the call that may have actually already had it. So if you were a sufferer, the illness lasts about 2 weeks. And then you might be infectious for a couple weeks after that, maybe even up to 21 days after that. So almost 5 weeks, and even a few days before you get sick, it's almost 5 weeks of time where a virus that you have could be spread to somebody else. In China, what they're doing is they're actually swabbing people to see if they're still infectious, to see if they can capture the virus on a nasal swab before they go home, before they go back to work. Are we going to get to that point? We'll talk again about that in a little bit, but we're not at that point yet where we can diagnose or screen people to see if they've recovered from their illness and decide, okay, you're safe to be around other people. We're not there yet from a testing perspective. So it could be, at least as I'm thinking about it, up to 5 weeks of possible spread. However, the CDC's recommendations don't exactly line up with that. What the CDC says on their website is if you have COVID-19 and you haven't had a fever for 72 hours and your symptoms are almost gone, then you can go back into the public arena, your family and work. They're behind because you have these asymptomatic people and they haven't really given us a lot of time. So I hope that helps answer the question, but again, getting back to that theme that is going to be pervasive throughout our question answer session, there's still a lot that we don't know about this. So we've talked about this a little bit already with regard to the virus getting on the hair and body. Do you have to come and wash yourself? Well, really, I want to reemphasize the idea of how we protect ourselves. And when we are in our house, as Dan said, when we're in our house, that house should be a place of safety for us. If none of us are sick and none of us, we believe, are asymptomatic carriers, inside our house, we have to, we're fine. You don't need to wash your hands multiple times a day because the virus doesn't randomly come into your house with a potential to infect you. So it has to be brought in by somebody, by you, if you bring it in after being around people without protecting yourself. So your home is a safe place, and if you're clean it a couple, disinfect intermittently a couple times a week, just keeping your house clean like you normally would, you don't need to worry about it unless you're going outside or somebody is coming in. And when you go outside, what we recommend is you wear a mask. And Steph will talk a little bit about the mask, as I said, but the idea is that you're reducing the chances, if you have it, of giving it to other people, and also reducing the chances if you come in contact or near somebody, are you going to get it from them? Now, let's say you take a walk in the neighborhood, and it's a suburban neighborhood where nobody is walking and no one's around. You don't need to be wearing a mask, because again, the virus isn't like a mist that you're going to walk through. So if you're not encountering anybody and you're walking with your children who are invited in your 6-foot zone of safety, you don't need to be wearing a mask in that situation. But if it's possible, you could encounter a neighbor who wants to chit chat with you for a couple minutes, well, you might want to be wearing a mask to protect yourself. Okay? So you come back in the house, you need to wash your hands. Well, if you've touched anything outside the house, it's probably a good habit to get into. Wash your hands with soap and water, 20 seconds, and you should be safe. What about going to the store? What about shopping? Well, here in Chicago, we're expecting our peak in the next couple weeks. So actually, the mayor right now has said, like, if you got food, enough food, don't even go shopping right now, because you're exposing yourself to risk, and we don't want anybody sicker now because the resources might be down in the hospitals over the next couple of weeks. So even further limit your outside your home activities over the next week or two. So, but when you're shopping, again, same thing, keep your distance, try and stay 6 feet from people, wear your mask, your hands, imagine them dirty. The moment you touch something, and you have to be really particular about touching anything on your person, your face or anything, once your hands are dirty. So those are some general ideas of how you can protect yourself. And at the end, I'll talk about, well, how long is this going to last, and how do we emerge from this as individuals and then as a society. So I'm going to pass this over to Steph so she can talk a little bit about masks.
So a lot of people have been inquiring about what are these homemade masks. A week ago, no one had even heard of them, and now they're all over the place. So the basics, we can send information with links if you're looking to make one. Couple good websites references offhand is the CDC. They have both a sewn and non-sewn masks, either with cloth, with bandana, with a t-shirt, pretty simple, cut a couple squares of cloth or, and they have patterns. And also Joann's fabric, if you are a little bit crafty and are familiar with them, they have some patterns and YouTube videos, and it's pretty accessible. I will show, this was one that one of our families made. So kind of the basics with your homemade mask is that you want 2 layers of fabric, A and B side, and you want some kind of elastic. You could, if you have elastic, or you can buy an elastic piece. That's, again, craft store. Otherwise, you can use rubber bands, you can use hair ties, anything that will hold it to your face. In terms of what is good with fabrics, cotton. The kind of 2 key words right now out there, cotton and woven. What this could be t-shirts, this could be pillowcases, this could be something that's not see-through. So think about if you're looking for scraps around the house, if you can see light through it, if it's like a trendy, cutesy scarf that a woman might wear for fashion, that's probably not good, because if you can see through it and there's holes, so can the germs get passed through. At the same time, don't make the fabric so thick that you can't breathe through it. Or don't make it so tight on your face that either your ears pull down or it feels like it's fleshed up against your mouth. So there's a lot of options of even stuff that's around your house. I know, my mom made old pillow scraps to make some masks. Just make sure that you can't see through it. That would be the key. And as with everything else, there's studies going on right now to determine what is the best fabric, but cotton is kind of the standard at this point. Couple key things about putting on a mask. I will not put on the cloth one, but I will put on this one. Try to hold, consider the outside contaminated, because if you have had a conversation or somebody sneezed in your face at the grocery store, that has fomites and that has stuff on there. So hold it by the sides, whatever your rubber bandy straps are, and then cover. To that end, try not to limit your amount of time that you're touching this part, and if you do, then certainly wash your hands. The 2 kind of key things when there's lots of different styles out there, make sure it's one that covers your nose. This is not effective, and yet I see this a lot. This is not effective. So if you're gonna make something, make sure it's something that will cover both your nose and your mouth, because we breathe through our nose and our mouth. And the idea with the mask is that you want to protect yourself if you are an asymptomatic carrier from spreading, and you also want to protect everybody else out there you want to protect yourself if you're the carrier, and you want to protect yourself from getting it from somebody else. Again, back to the social distancing, if you keep your 6 feet of space, it is less likely to come into your zone, yet this is one more barrier for that. Then when you get home, just kind of take it off and fold it. You don't have to, so the other question is maintenance of these. Assuming this is cloth, it's not a one and done. It's almost similar to a lot of your other clothes. You can wear them several times. You can wear them for several days before washing them. Washing is really the same thing you do with your clothes, because it is fabric. There's no shelf life to say after 6 wears, you're done. It really is kind of a judgment call, in the sense that the biggest thing is your elastic. If your elastic breaks, you really need to either repair it, put a new rubber band on there, or get a new mask. The other thing, when you wash it, either so that we protect our elastic, either put it in like a lot of gals might have like an undergarment bag, like that you wash bras or something with hooks, or a pillowcase. If you don't have that, just tie up a pillowcase. You want to protect the elastic. So don't just throw it in your wash with everything else. But let me say this, you can wash it with everything else, as you're doing your wash, but make sure that this is somehow kind of separated into its own thing. There was a question about, can you put it in the microwave and nuke it? That would certainly nuke off the virus, though we don't necessarily recommend that. It's really not necessary. I would say just put it in with your laundry stuff. Let's see, what else? Sizing. It's a bit of a guessing game. I wouldn't, if you're gonna, so the other thing, if you don't make them, Etsy is a good place, or unless you know a seamstress or a mother that can make that kind of stuff. Etsy, things to search for would be mask. You could even do cloth mask filter, which I'll talk about in a sec. But in terms of sizing, I wouldn't go small, because the two things that you're gonna have with a small mask, A, it's not gonna cover your face, and B, the elastic is gonna be so tight that you're gonna pull your ears in and you're never gonna wanna wear it. So I would, large probably fits everybody. Depending on your body, I would go kind of like a medium to a large. Again, it doesn't, it's not like a t-shirt that it has to be a good fit. You really just want to cover that nose and that mouth. But you don't want it to be tight. You just want it to be, you want to have coverage. Will had kind of touched on when you should wear it. If you don't have to wear it in the house if everybody's healthy and everybody's been within your 6 feet of zone. But outside, especially if you're going to a grocery store, especially pharmacy, anywhere that you're going to have a lot of people. But you could also think about it that you're going to put this on every time you walk out of the house, because you don't know when you're going to chat up a neighbor or somebody that's going to be within your 6 feet of zone. This does not replace by any means that 6 feet safety zone, but this is an additional barrier. Again, to protect really with the asymptomatic, even if you don't have symptoms, you don't want to be passing it to others. If other people are not coughing in your face, it doesn't mean that, they don't have the virus. I think that's it.
Yeah, thanks, Steph. I think the question of cleaning and sterilizing, Karen made a comment about putting it in the dryer. We're not 100% sure on a lot of this stuff, and the mask recommendation, we made ours, a week ago Monday, and then the CDC on Friday. So all the masks got sold out and the supplies got sold out and everything over the weekend. And then we'll find out, and people will begin researching and deciding what the best way is to disinfect these masks. But for now, we know that the virus doesn't survive with soap and water for 20 seconds. So if you put it in a washing machine with soap and water for a half an hour cycle, that's likely gonna kill it. So one last thing about, you want to say something about filters?
Yes, that is, filter doesn't hurt. It's not necessary. So what is a filter? Sometimes if either you can make one, there's a one on the CDC website that has, it's like a bandana with a little pocket for a filter. Furnace filter isn't an idea, obviously one that's new. You could put tissue in there. You don't have to have a filter if you're buying something on Etsy. You can search for that or not. The idea is that, again, the more layers that you have in there, the better protection. So it's not, certainly it's okay. It's not a deal breaker if you don't have a filter though. The real thing with the cloth is two pieces of cloth.
And I think, as Steph just said, the value of a filter is, again, increasing the capacity of, or decreasing the ability of the virus either to get out of your mouth and nose into the environment and the other way around. The more barriers there are for that virus, the less likely it is to achieve its intended goal. There are the N95 masks are going to be the best, but we want those in the hands of the first responders in the intensive care units and emergency rooms. And people cleaning those rooms. So, that's our main intent. But again, the best strategy, social distancing, keep your hands clean, and the mask is an addition to that. It shouldn't replace by any stretch the social distancing that we're trying to do. So I think, Meg, were you going to talk about, so all of our members here and, a lot of folks are calling us and telling us about how they're feeling, and we're trying to kind of guide you all in real time. So Meg, do you want to talk about what folks should do if they think they might be symptomatic?
Yep, so the question, and this is kind of a consolidated question of several questions. If you think you have COVID-19 symptoms and you are a member of Harper Health, the first 3 action steps you should do. So the very first thing you should do is call us, obviously, and let us know what your symptoms are. We're here to help you, and we will stay in contact with you throughout everything. In terms of diagnosis, we do have testing and are expanding that testing, which I think somebody's going to talk about in further detail shortly. It's important, and if you call us and we go through everything with you, if you have symptoms, you have to self-isolate. And we can help guide you through the process of that, based on your personal living situation. But I think it is important for us to kind of preemptively think about how would we quarantine in our own homes if we needed to. Like how would we divide up the house, if we needed to stay away from other family members? Is there a bedroom that has an ensuite bathroom situation where if we needed to isolate ourselves, that that would be where we would do it. I think it's important, I want to stay positive, obviously, but I also want people to be prepared and just to think about what is the best setup in their home if they do have to end up isolating themselves from other people that might live there. And that's, again, something, if you start to have symptoms, that we can help guide you through. And in terms of the symptoms and what else you need to have at home, fever is a big symptom for a lot of people. So hopefully everybody has a thermometer or 2 at home. And it's important to check your temperature frequently. There's some studies that have shown that letting your temperature run a little bit on the higher side may be a little bit protective, as the virus doesn't like heat. But obviously, if it gets to the point where you're uncomfortable, if it's over 101 or something like that, I would recommend that you take Tylenol. We don't want anybody to run really high fevers. That can be dangerous too. So Tylenol is definitely better than ibuprofen, and then drinking a lot of fluids. In terms of supplements, I see things popping up on the chat. I'm taking vitamin C and zinc, and I think that those have been shown to help with immunity. Some people are also taking vitamin D. So, those I think would be the main supplements that I'm taking. Other things to monitor if you are feeling sick or if you do feel like you have the virus is your breathing. I don't think that it's necessary that everybody runs out and buys a pulse oximeter, which is a device that you put on your finger to measure your oxygen level. I'm not saying that it's a terrible idea, but it's important to realize that by the time your oxygen level starts to drop on the pulse oximeter, it's already pretty late in the game. So the pulse ox doesn't start to drop until, you should have already, really been thinking about seeking additional care. So I think other things, instead of relying on a pulse oximeter, would be to think about, do you feel short of breath? How many times are you breathing in a minute or something like that? Can you speak in full sentences or carry on a conversation? Can you walk down your hallway or climb your stairs in your home? Those are other ways to monitor your respiratory status rather than relying on a pulse ox, which may read normal, even if you're going into a respiratory distress. For the cough, they're just recommending dextromethorphan, which is Robitussin DM. And then the fatigue, body aches, just rest as much as possible. No need to push yourself. Nobody's going into work for the most part anyway.
I think it gets to the symptoms of COVID-19. And when this first came out, the three things I always talked about was fevers, cough, and shortness of breath. And what we're realizing is that the symptoms, as we talked about earlier, can be nothing, 25% of people. Or they can be things like diarrhea, headache, sore throat, belly pain. We've heard stories of people coming in to, get their appendix taken out emergently, and they have COVID pneumonia, and they didn't have a lot of symptoms related to it. But what do we care about as your doctors and your providers? What do we care about? Well, we obviously care about how you feel. And when people have a significant case of COVID-19, they feel wiped out. They have no energy. The fever can be, really uncomfortable. But what do people really get sick from? What do they end up in the intensive care unit for? It's not because of fever, and it's not because of fatigue. It's because of pneumonia. Pneumonia is the main pathway for people to end up in the intensive care unit and to end up on ventilators. So what is pneumonia? Well, pneumonia is where initially for COVID pneumonia, the virus causes an infection deep into the lungs, into the little tubes, the little sacs that transfer air from your breath into your bloodstream. And that pneumonia makes it difficult to breathe. That makes it difficult to move oxygen into your bloodstream. And so not everybody who gets COVID-19 ends up with a COVID-19 pneumonia. So when we talk to you, when we advise you and counsel you on how sick you are, the main thing we're looking at and the main thing we care about is, do you have COVID pneumonia? And if we think you do, and you're breathing heavy, and as Meg was talking about, then we're going to have you go in to the hospital, because that's what will really put you at risk for significant illness. And then kind of what do people end up on the ventilator for? Well, that people, sometimes you may have heard of the cytokine storm, or your own body fighting against each other. Well, what can happen in some patients is your own body's immune system, in trying to fight the virus, really sends this army into your lungs to try and kill the COVID-19. And in the end, it overwhelms your lungs in and of itself and causes a syndrome called ARDS. And that's an unfortunate situation, particularly for people who have underlying health issues. And so, again, getting back to it, not everybody with COVID-19 gets COVID-19 pneumonia. That's the main thing that we're going to be tracking and watching out for. And if you have fatigue and a fever and a cough, but you're not out of breath, we're going to just be supportive to you. And again, Meg's mentioned a couple of vitamins and supplements and things that we can try. But right now, with regard to treatment, we don't have a ton to offer. Remember if this is Dan. You want to talk about this, Dan?
Okay, so that kind of dovetails into what I was going to talk about. What do you think about the use of iodine to treat COVID-19? And can you talk a little bit about the treatments and the development of a vaccine? So the long and the short of it is, as Will just said, there's been no proven therapeutics that have been effective for treating COVID-19 pneumonia. The data that's available is not high quality data, which is understandable because we're trying to identify possible treatments in real time while responding to the pandemic. The standard of care is supportive care. And what do we mean by supportive care? There's a lot of things that we can do for patients as they go down or as they get sicker. One is, putting patients on the ventilator. We don't want to put patients on the ventilator, but it's far from just a passive sinking ship where we're not doing anything. In many cases, the ventilator can kind of temper someone through to the other side of their illness. We can support blood pressure with blood pressure medications, and we can treat bacterial processes. So sometimes it's the COVID-19 pneumonia, and it's the viral pneumonia that is creating the problem, but sometimes it's a bacterial superinfection on top of the viral pneumonia where antibiotics are important to administer to patients and kind of get them through to the other side. So I don't want to make it seem like a passive process because a lot of things get done with supportive care. But to answer the question directly, there have been no proven therapeutics. Iodine, when I looked up iodine, I didn't see any data. I just saw that it could be used as a nasal mist or a gargle. Sometimes for hospital personnel that are coming into contact with inadequate PPE. One thing that's really been talked about a lot and made popular news is the hydroxychloroquine, which is known as Plaquenil, in combination with azithromycin. So there was case reports of patients, shedding decreased amount of virus with the, I'm sorry, my daughter is trying to.
Zoom bomb. She's Zoom bombing.
Yeah, she's Zoom bombing you. Emma, what do you need? Okay. So as I said, kind of what's been popularized is the Plaquenil and the azithromycin, but we don't have good data to suggest that that's effective, although it is being given. It's being given at Northwestern for patients. Kaletra is an antiviral that was initially used in HIV. There was actually a randomized controlled trial done in China with 200 patients, but it showed no benefit to Kaletra. And the other one is remdesivir, which was developed to treat Ebola. Wasn't very effective for treating Ebola, but it may have benefit in COVID-19 patients. And actually, Northwestern is one of the sites that's randomizing patients to get remdesivir when they're very, very ill. The other thing that I've seen is convalescent plasma. So someone who has had the infection and then cleared it, we sometimes give their plasma to patients who are gravely ill. It contains antibodies against the virus. And so there are case reports of patients doing better after receiving convalescent sera. But again, it's not in a randomized controlled trial setting. In medicine, I always tell the residents when I'm on teaching service, or I try and impart to the medical students, that there's sins of commission and sins of omission. And so we don't want to just do something for the sake of doing something in terms of throwing therapies at patients that we don't have a lot of good data for. I think one of the things that Meg brought up, which there's little downside in taking zinc and vitamin C and vitamin D to support your immune system. As for how efficacious it's going to be, I don't think we have good data to support that, but there's little downside to doing it. And then talking about a vaccine, so there are 2 vaccine candidates that have started stage 1 clinical trials in humans. One is funded by the National Institutes of Health and the Centers for Disease Control, and the other is funded through the Bill and Melinda Gates Foundation. But we think that we're probably still 12 to 18 months out before we see a vaccine that's effective. That's kind of what I had on treatments and the vaccines.
So this has come up a lot this week, and we wrote an email a blog post a few days ago about testing and what the updates on testing have been. And really, it's been a challenge to get tests. People that are getting tests, at least initially, were generally the sicker people, the people that were ending up in the hospital, so we could define whether they needed isolation or not. But I think the tests are starting to increase in availability, and so we're actually going to start considering as a population what the strategy should be. So I think it's important to think about as you read and as you're sort of seeing what's going on. It's like, what do I do for myself, and what should the country do? That there's different strategies, and in an individual level, our role and our goal is to help you make decisions for yourself. So if you have questions about what you want to do and how you want to approach it, please reach out. We're thinking also in a population way for our patients. What is Harper Health's strategy going to be from a testing perspective? And then there's going to be the, Chicago or your local environment, as well as country strategy. But there are tests now that can test whether you've had the virus already. Those are called the antibody tests, immunity tests. And as I mentioned in the email from a couple days ago, when you first get exposed to a virus or a bacteria, your body tries to fight it off, creates these antibodies called IgM. They're like little stickers that identify a heat-seeking missile to come in and kill the virus. And then over time, your body develops a different kind of antibody called IgG. So in the early phase, if you have IgM antibodies, that means that you've recently had an infection. Those will fade away, and then you'll get IgG antibodies that show that you had an infection in the past. And there are blood tests for that. If you've ever been overseas, sometimes we do a serum test to see if you've been immunized to measles and vaccinated against measles. And eventually we'll have a serum test where you draw blood and we look to see if you've been immune to SARS-CoV-2. We're not there yet, but where we are is a finger prick test, which takes a sample of blood out of your finger. There's a little card. It's about a half an inch, maybe an inch by 3 inches. You put a sample of blood in there, and it's like a pregnancy test or a strep test or a rapid flu test. Within 10 minutes, you know whether you have an acute infection or whether you're in the convalescent or recovery phase, IgG. So that test is starting to blow. They're just starting to deliver them. They're going to be all over. And it's a little bit test before we know how to use that as a strategy. Harper Health just today, this morning, got our first of 1,100 tests. We have 1,100 on order. We've gotten 100 so far. And in a couple weeks, we're going to get 2 to 3 weeks, we'll have our second shipment of 1,000. And what this is going to do is allow us to offer you a more rapid approach to testing. For some of you, you got tested and it took 8, 9, 10 days before we got a result back. This way we'll be able to know within 10 minutes whether you've been exposed and immune to it or not at all. So we as a team are developing our strategy for how to use these tests. And because we know some of our folks are actively in the watchful waiting phase, or we're watching them, we're going to reach out to people and invite them to get tested. We've also had folks who have been tested positive, and we want to confirm that the test works. So we might invite them to come and get tested to make sure the test we have is an accurate one for our practice. And then we're going to roll out a strategy that we believe is really the way we should approach getting back into society. We know that we're all going to need to emerge from this hibernation that we're all in. How do we approach that? If you knew you were immune, you could go about your life a little bit with more confidence. But if we knew that you were at risk because you hadn't been infected, we can counsel you in a different way. So with that in mind, how does this second wave thing, right now, the reason why we're all in hibernation is to really protect our hospitals from being overwhelmed with infections. But the moment those restrictions get lifted, the chances are that you're going to go into an environment where you could get infected again. And it's possible if everybody stayed home and nobody went outside and nobody exposed each other to anybody else, after 2 weeks, the infection will die out. Because your incubation period, you get sick, 2 weeks, you get better, the infection will die out. But we have open borders. People will come and go. We have states that haven't locked their, really done a great job with shelter at home strategies. So once we start emerging from our homes, if we haven't been infected and we're not immune, it doesn't take much, particularly if we are 100,000 people in the big house in Ann Arbor, or in the shoe down in Columbus, there's really a chance that we could get outbreaks again. And that's what the second wave is all about. And when this happened back in the Spanish flu epidemic or pandemic, people had a false sense of security, and they just went back to normal life and maybe even celebrated that. And as a consequence, the second wave was worse. So as a micro strategy, as for you as Harper Health members, we're going to come up with our recommendations for you. They may or may not align with what the public health strategies are that are coming from our federal government. I suspect they're going to align pretty closely with our local governments. But we will make those strategies and make recommendations, and certainly you have free will and you can choose however you want to approach that. But in terms of being safe and how to protect yourself, part of that is going to be, can we test you to see if you're immune to it? So patient asked if we test as having the antibodies, the serology would be a candidate for giving blood. So Meg mentioned, or Dan mentioned the convalescence. Yes, if you test and it shows that you've been had the infection and recovered from it, then there's a chance that you could be somebody who could donate your plasma to a sick person. The challenge, a little bit of challenge with these antibody tests is that they're not 100% specific to SARS-CoV-2 virus, the virus that causes COVID-19. There are 4 or 5 other coronaviruses that cross-react with this antibody. So if you've had one of those coronaviruses in the past, it's possible that your IgG could be positive. So we can't 100% rely on this, which is why we need that serum test that will be 100%. That says, yes, you're immune to SARS-CoV-2. Yes, you can donate your plasma. Yes, it is unlikely that you'll get infected again. Unlikely that you'll get infected again. Not 100%. We still, again, going back to the common theme, we'll know more as time passes. We don't know 100% whether, if you've had it once, are you immune from getting it again? We believe that's the case, but we're not 100% sure. There are some reports of some individuals in China who had tested negative, meaning they had no more virus, and now they're testing positive for the virus again. That's with a nasal swab. We don't know what that means yet. We believe, Dr. Fauci believes, that it is likely that once you've had the virus and you're immune to it, you won't get COVID-19 again. So we are at 2:03. Let's see if we have, I think that's the last slide. I certainly encourage folks, to reach out to me or to Dan or to Steph or Priscilla or Meg. And if you have questions about how you're feeling, about concerns that you have about being sick. And as I said, we will reach out to folks that we think would be eligible for this first little teeny sample of tests that we have. And then once we have a bigger supply, we'll have a strategy for how we can support you as we begin to consider how we're emerging from our quarantine, self-quarantine. We tried as best we can to answer as many questions as possible in the 64 minutes on the call today. If there's a burning question that you have that wasn't answered today, please ask, please send another message, and we'll do the best we can to answer it. And know that we're going to try and do this again, when there's more information to pass on, more questions, more sort of support we can try and provide face-to-face. So we look forward to that again, and we certainly look forward to having you all back in the practices and back seeing you face-to-face in the office here. We look forward to that as soon as we can, safely. So thanks for joining us today. We had a real nice, let's see, how many total do we have? 69 people, which is a great number, and I really appreciate all your support for Harper Health, and look forward to helping continue to guide you as we move forward with this. You all have a great day and stay safe.
Thanks, Will.